Good afternoon, everyone. It's a very tough session to moderate, being the first session after lunch. So, can you all please just settle down? It's very rare to get such amazing stalwarts who build this nation. I'm serious, I'm an electrical engineer. I don't know how I ended up with such great stalwarts. The people who build the scientific consciousness of our country are on the stage, And I have to thank Satya and his team for pulling them together, and my absolute honor to be sitting with them. So, lots to learn from them, and we'll get going directly. As we know, this is Indian healthcare innovation and translation crossing chasms and bridging gaps. India is at a very important crossroads, right? We have the demographic dividend. We claim to have good scientific talent pool, yet there are huge challenges ahead of us. And we want to use this panel to be very constructive, forward-looking. We know lots of things are broken. Government labs may not work the way we want, etc., etc. But the opportunity is much bigger and is the overarching goal of why we are there. And the folks who are here, each one is, as I said, an institution builder, a nation builder, and it will be lovely to hear from them. But ladies and gentlemen, I want to start with a couple of quick comments, right? If you look at China, they spend 5 to 6% of their GDP on R&D. We spend 0.65%. We are not a China. We don't need to be a China. But there are some important lessons to be learned about how those nations are progressing ahead, bringing artificial intelligence, coming out with new regulatory paradigms that are making accelerated healthcare discoveries and deliveries happen. So insofar as we want to learn from the best and be humble about it, it's important to also keep these numbers in mind, right? So lots of challenges, but lots of opportunities. So what I'm going to do is my esteemed fellow co-anchorer, I'm going to ask Professor Sashidhara to give opening comments, after which we'll go through each of our panelists to spend 2 to 3 minutes to speak about the topic, and then we'll come to a round of questions. Over to you, sir.
Thank you, Anand. Thanks again to Satya and BFI for providing this opportunity here. Quickly, definitely we are not going to discuss the problems. There's no laundry list of problems. There is definitely a long list, but we can still do much better. And I'm sure we are already in that kind of a mode in the country. 2025 started with a big bang. In variety of different way, you can call it as big bang. With variety, the whole global geopolitical situation is changed because of one person and variety of different other issues that are coming up. But in context of science and technology, the most important thing is what started in the late 23 and early 24, and which actually took off really well, is artificial intelligence, right? And in that context, and the way biotechnology and biomedical research and also agriculture, particularly in the context of climate resilient agriculture, how it is going forward in the world, and where we are and how we need to sort of capitalize in this kind of a trend, where India can actually have a specific advantage because of, as you said, demographic dividend that we have. And also the scientific community, we may be a smaller scientific community in terms of proportionate to our population size. But that community is quality-wise, if you look at top 5% of Indian scientific community, they are equivalent to top 5% of anywhere in the world. I don't think there's any distinction. We may be working in low resource setting conditions, but in terms of quality, I don't think there is any compromise. So given this, what is that we need to do to capitalize on what's happening in the world in 2025? We already completed 1/4 century of the 21st century. And obviously, this remaining, in Indian context, we are moving from 75 to 100 years of independence. And the world is also moving to the next second quarter of this century. And with the AI and with CRISPR-Cas9 in the context of biomedical research, I guess this is a big opportunity here. Definitely, we don't need to worry about China. We have done whatever we could do at low resource settings, but with big philanthropy coming in, thanks to BFI and many other young philanthropists in the country, I think we can now move much faster at an accelerated pace and also expand our community. So in that context, perhaps what we can do is we can actually ask questions to our panelists related to what is that we need to do today to reach what is that envisaged for 2047.
Brilliant. Did you did you notice twice or thrice he said about, despite low resource setting, we are doing innovation. There are 8.5 billion people on this planet. Western innovation is likely to touch 1.5 billion. The remaining 7 billion in the planet can potentially benefit from solutions that come from India, contextual innovation. So thank you for that. So I'm going to request our panelists to spend a couple of minutes to give their opening thoughts and comments about the topic. Over to you, Professor.
So I think, first of all, pleasure, Satya, to be called here. And I think what I'm going to start with is a very simple statement Dr. Mashilkar used to make: to deliver more value for less money to more people, right? And to combine that with something that Mr. Nailwal said yesterday. This is an aspirational India. We are no longer simply trying to deliver the basic at a lower cost for all people. We are actually trying to create first in the world products. And AI is going to be such a transformative part of it. Because in many ways, the tools it creates, especially via current open source, via even publicly available, at least temporarily free, are actually there for everyone. And these things can be absolutely transformational. But the dividend of India that we say our young people can also become a burden very, very fast if we fail to do it. So health innovation in India should no longer only try to look at trying to provide for more people, creating similar systems as in the West at a lower price. We absolutely need to create a sector for innovation, trying to answer problems that are high value anywhere in the world. Not only high value to us because we have a specific need, that's very important as well, but we must truly be aspirational. And many of the tools that are required to do this are actually now available at the Indian research ecosystem. I would actually say that many of our institutions now have facilities comparable to the world. We can strengthen the ecosystem further. What we really need is for us to understand the world has changed and for us to change accordingly. I'll stop here for now.
Brilliant. Thank you so much for that. And Dr. Malathi, over to you, please.
Yeah. Thank you. Thank you, Anand, and also thanks, Shishidhara. Thanks, BFI. So the topic really, I'm an IP specialist. Been a scientist, of course, and now I'm an IP specialist. And when I see the IP in India versus the other countries, one of the things is the research funding is low in India as compared to, let's say, China, Europe, Korea. But if I look at South Korea, they're minuscule population, but you take any subject, whether it's electronics, whether it's AI, whether it's cosmetics, or whether it is biology, and they're changing the scenario. So if I'm not even thinking China, China is way ahead. But can we now at least catch up with these countries like South Korea? If you take Samsung we always thought was an electronics player. They came, and we buy all Samsung products, fridge, TV, air conditioners. But people don't know, when I did this report, there is a lot of things that Samsung is doing in the biotech field, which is antibodies, antibody engineering, biosimilars, CRISPR, name it, CAR-T, and they are into every area. And so when people have realized, yes, biotech is the next revolution, and they can't just stay in only into electronics and so on, I think this is a lesson even for industrialists and other labs, that how do we quickly move from where we are to what it is. So I think this, like what Vijay Chandru said, it is the internet age. It is the AI age. Can we now put all these in AI and see what does India need? What 4 solutions we need? If we get those 4 solutions that we need to do this, I think we should be able to leapfrog. So what did China do? They copied a lot of these seminal work being done abroad, whether it is AI, whether it is semiconductors, whether it is electronics. Can we now quickly move with low resources, but then scientists in R&D labs or government university must work with the industry or must work with what are the unmet needs. And a lot of people in the medical field, they're doctors, they really don't know what is patenting. And also our patent system is not very friendly because method of treatment will not you give patents for, or repurposing of a drug. So we can do those type of work, repurposing of a known drug, which are already safe and got the regulatory approvals, can they be used for certain indications that India can do? But if you don't give the IP for that, then why is anybody going to work in that area? You need some incentives. And if you do it, but I think, okay, India doesn't allow repurpose and you can license it to other countries and see that. So I think we need to now is the age with internet, AI, can we now leapfrog and go to the next level?
Brilliant. We heard both the speakers here talking about leapfrogging with AI, and obviously we need very strong IP infrastructures. I'm going to request my friend Deepanwita, who pretty much founded incubation in biotech in this country, to share her thoughts broadly on the topic.
Thank you, Anand. Thank you, Shashidhara. Thank you, BFI, especially Satya, for inviting me to this August gathering today. I was very inspired by today's morning session. Everyone, each speaker spoke from their experience and their heart to say how we can make a difference for India, in India. Because for India, not outside India, for India, in India, it's like by the people, for the people, and I would add with the people. How do we reduce inequity? How do we increase access with all the kinds of new technologies that we want to bring in? If we cannot reduce inequity, not only in equality, in equity, in each field, and without healthcare equity, we won't have a generation which can actually leapfrog, because we will not be able to have the brain power to do it. So reducing malnutrition, reducing all these things, because healthcare access and equity come kind of together. How do we look at technologies? That's why I thought it was very important when we looked at the awards, there was a Public Health Innovation Award. And I think it's extremely important to look at public health, maternal and child health. Otherwise, we will all be talking about this 10 years later, again sitting in the same kind of a room, discussing why did we not make it. We have to build our next generation. Our next generation are the children that we have to just not feed nutritious food, feed proper healthy food and proper health access. If we can do it through our technologies, through the leapfrogging of technologies, bringing in newer technology, reimagining primary health care, reimagining healthcare, I'll wait for that time. I'm waiting for it. Thank you.
Reimagining primary healthcare. I mean, India can never become a developed country in the world, even if our GDP keeps rising, if we don't invest in health and we don't have a healthy population. The demographic dividend that Professor Sasidhara spoke about will just fall off if we don't have a healthy population. So it's so important, and public health is where it all starts. Thank you. Professor Souvik, love to hear from you, please.
Thank you, BFI team, to give us opportunity to discuss one of the important, point, at least at this moment, which is, whole country is thinking like how to come out with innovation. So I'm a basic scientist by training, at least in like up to 2014, 15, I used to practice as a basic scientist, and later on I have transformed myself how we can use our basic science knowledge to come out with some kind of innovation. So having said that being a basic scientist, I feel that one of the gap which we see that, in our academic sector at least, is that initially, unless until we are not involved in invention, that will not lead us to innovation. And how I do see invention, as again a researcher, invention, you can imagine a black box. In one end, you can put lot of amount of money. You do not know what is going to come out. Okay, and whatever is coming out from that black box of invention can be put back to innovation black box, and something will come out as a money. Okay. Now these two things are not often connected in academic sector, and the first box, invention box, can be led by individual scientist. Very basic questions like CRISPR-Cas we are discussing. Okay, when in 2010-11, scientists from Broad Institute or Berkeley Institute, they are just looking for how bacterial immunology works, a basic science. Okay, then they have come out with a observation that can be repurposed for something else. Then innovation started using this invention. So unless until if we do not connect these two boxes well enough with lot of cross-disciplinary expertise, we will be always lagging behind. So what I mean that cross-connectivity between disciplinary also is mean that, chemist, biologist, and engineers. Till now, I feel that lot of clinical knowledge we get input to come out innovation, but still engineering knowledge is lacking, at least in academic sector. So unless until if we do not collect, scientists from multidisciplinary ways, we always will be lacking behind to come out, new technology and new, solutions for healthcare. Having said that, again, I will emphasize that this is the best time because, after COVID, we have understood the value of healthcare, health technologies, and that at least are helping us to bring people closer, like cross-disciplinary people. And I look forward to have much more such kind of collaboration in near future, which will help us to give more innovative, solutions for our problem. Thank you.
Thank you very much. Multidisciplinary approach required more than ever. And COVID clearly taught the whole world that without health, we don't have a society. Thank you for those comments. Last but not least, Dr. Ashish, your comments, opening comments,
Anand.
please.
Thank you, Shashi. Thanks, BFI team and Satya particularly. I think in the AI biotech space, there's a lot of happening as I see it. First and foremost, the infrastructure for AI is going to grow in this country. High-end compute data centers are booming right now as I see it. Biotech, industry, academic, a lot of expertise already exists. And there are many of those very India-specific problems that absolutely need to be solved. And coming back to, so we have all these three dimensions, and coming back to what Anurag said, more for less for more, the Mashelkar magic formula. How do we do this in India with research investments being only 0.65, 0.7%, right? So we have on the one side a lot of infrastructure, a lot of expertise existing. On the other side, the R&D investments are less. And on the third side, a lot of problems that need to be solved at the lowest economic strata. And I think perhaps a smart way of doing this is to leverage existing ecosystem. Going back to what Professor Chandru said, convergence, leveraging the ecosystem to achieve convergence. So to get to a product, as he said very nicely in the morning, you need AI, you need material science, you need chemistry, you need semiconductor, you need electronics, you need all of those need to be, to come together to deliver a high-end, first-to-the-world product. All of these exist in silos. And instead of building them in one institute or two places, can we be smart enough to leverage the existing ecosystem And that, I think, is perhaps a way to achieve a lot more from a lot less for a lot of people, delivering a lot of impact. So I think we need to come up with innovative formulae, innovative structures to leverage existing ecosystem and achieve that convergence. That's perhaps how I feel.
So leveraging existing ecosystems, pulling them together to enable convergence. You know what this reminds me when I hear this August group speaking? I came from a chip design background, right? So when voice, data and video came together, that changed the world. I see that happening now when biology, biochemistry, molecular biology, AI is all coming together. This is almost like that in terms of the disruption and the opportunity it's going to create. So thank you for the opening comments. Over to you, Professor Sashidhara.
Great. I think the first round of thoughts from our panelists has been very encouraging, very positive, and outlook in, and also some kind of a solutions are emerging. So I'll start a question to Anurag. You know, we spoke about interdisciplinarity, multidisciplinarity, Souvik also mentioned, and we also talked about demographic dividend. If innovation is an emergent property of large ecosystem connecting to each other, and how do we achieve the increase of the size of our community, which is important. The scale of the community is still very small. And how to expand that community size at an accelerated manner, where they'll have the foundational knowledge, at the same time advanced technical skills, and also some amount of interdisciplinarity, multidisciplinarity. I understand that an individual doesn't have to be interdisciplinary, but as a project, multiple people coming from different disciplines need to work, then they need to understand each other's language. How do we achieve? Ashoka is a good example where I'm sure you must be experimenting on this.
So I'll come to Ashoka in a few minutes. When I just caught the eye of Dr. Ram Gopal Rao, then I saw Souvik speak about invention and convergence. One of the challenges in putting anything together is ultimately it must start from people. And whatever formula has not worked so far is unlikely to work if you carry it further into the future. So at Ashoka, what was decided was that rather than having very strict boundaries between areas, the future of, let's say, health AI, will it be by biologists who learn AI tools? Will it be by AI people who learn biology? How does it matter? As long as you create the ecosystem that the IITs have tried to do, and I know BITS is currently also trying to do, many other ecosystems, people can seamlessly from education onwards pick courses and areas so that when they come out are not defined by a single discipline. Instead, they cut across the variety of knowledges they would need. Now, why is this important? You could say, why can't we take a bunch of medical doctors and a bunch of engineers, put them together and ask them to make a solution? It doesn't work that way because they don't speak the same language. If they don't speak the same language, they're unable to correct each other. They simply nod their head when the other person is speaking. And until you create people who speak multiple languages, you're not going to translate anything at all. And that, I think, is something that the new education policy is very well designed to do. Now, the trouble is the conventional entrenched ecosystem would have to change.
Yeah.
And much of that ecosystem is on the public side. And the hardest thing in a public ecosystem to do is to bring the change. So ultimately, I think the private system must come in. BFI was built on private money. Ashoka is a philanthropic university leveraging private money. Even when we speak of other countries investing X number of percentages in research and R&D, the amount of money that comes from the government is typically below 2%. The rest comes from the private sector. India at 0.7, 0.8 is behind, but not that far behind. The private sector at 0.1, 0.2 is well behind the global average. So I think both private money for societal benefit, that because of CSR we have, and private money for money benefit. And I'll make this last point before I end. Even if you were to look at the monetary benefit value chain, it used to be a straight line. A certain amount comes from the idea, a certain amount comes from the manufacturing, a certain amount comes from the sale and distribution. China flattened the middle. There is almost no money left in simple manufacturing if you don't have the idea. So we must invest in a generation of people with new ideas, because we actually cannot rely upon becoming a manufacturing nation. We must do it to provide the jobs, but we can't use it to become a rich nation. Over.
Great. So, just Anand, I think it's a fantastic point, the last point that you mentioned, that all of them should also become thinkers rather than simply, the university should not become manufacturing machines of graduates. So one point I just wanted to highlight in the education system, which we need to change. I think it starts from the faculty orientation and faculty development program, because they are the ones who are coming from the past to tell our today's students what they need to do in the future, right? So I know the faculty from the past has to be at least know what is in the present situation, even if they cannot foresee the future. Some of you, of course, have a good foresightness to see the future. People like Vijay Chandru actually engineer the future. So perhaps we need to set up these kind of interaction with existing faculty. Otherwise, we cannot scale it up. Yeah.
Thank you. Just before I go to Deepanwita for a question, ladies and gentlemen, a point that Anurag made, right? As a country, we spend so little on R&D, particularly on the private side. It's next to impossible, and it's so rare to see an organization like BFI spending 1,600 crores on R&D in our country. I think we need to give a huge round of applause and appreciate that. Let's not take it for granted. And organizations like BFI or Ignite are seeding the foundation for the next generation Wellcome Trust and Bill and Melinda Gates to come from here. Maybe the Ambanis and Adanis will write billions of dollars after they see such important steps. Coming to you, Deepanwita, as someone who's a founding mother of incubation in health tech, etc., I'm going to pose you a question and say the world is changing and changing dramatically. There are many incubators represented in this audience. If you have to write, or you get the opportunity to write the blueprint for 2.0, how will Indian incubators and accelerators need to look at to keep up with the times?
Great question, Anand. I think there are about 1,000 incubators in the country. Take maybe a little less, little more, because it's just not the central government funded incubators. There are line ministry, of course, funded, and also state government funded incubators, private incubators. Out of which BIRAC probably has funded about 100 incubators, so life sciences incubators 100, but that's plus because there are a number of incubators, tech agnostic ones, sector agnostic incubators that look at healthcare. So I would guess about 400 incubators in this country are looking at healthcare, not biotech, but healthcare in various formats. So there are huge number of enablers in the sector, in the ecosystem today. So how do you distinguish what value you are adding? And the global ecosystem, global startup ecosystem report that came out very recently last week, it says that ecosystem value globally is declining. What value an ecosystem players can add is globally declining because of AI. So startups today have tremendous access to technology, and in this kind of a scenario, I think incubators have to reimagine themselves, redeploy its capabilities, retrain themselves in order to be relevant. Otherwise, we will not be relevant. If I ask Satya today, BFI is a great enabler. Should incubators look at becoming something like BFI kind of work? But they may not have the funding available, because what is hugely constraining of all our small incubators is funding. Do we need, so is there a consolidation hub and spoke model of incubation where budgets can be pulled and work together better? Because if we cannot add value to startups to the ecosystem, to innovators, including academic innovators, I feel will become irrelevant, and it will be finally either seed funding or venture funding or organizations like BFI that would take the place of incubators. You know, 3 things that incubators can, if I can take another minute, Anand. One is to look seriously at infrastructure. What kind of infrastructure is needed tomorrow? If I look at TCS, what is happening today, 12,000 mid-senior level people have already, they lost their jobs, have been asked to leave. Is that a signal for our industry or not? Have we asked ourselves that question? If this is happening with TCS, all IT, ITS industry would follow that. I was looking at the Tata Automotive Financial CIO, Vipin Gupta. He is saying 20 engineers in Pune, 20 automotive engineers, what they can do in 6 months, 3 AI agents can do in 2 days. Where are we? So I think incubators have to look at training people. I think training and upskilling should become a role that incubators have to take up. Because who's going to do it? Can academic institutions do it? They have their own limitations. I think that this is the enablement of the ecosystem that's needed. I have other points to say, but we'll take a round and I'll come back again if I get a chance.
Great.
Thank you.
So you want to add something, Anurag? Go ahead.
I want to add a paper that I think everybody in the room should read. Just look at it. It's called The Virtual Lab. It's from the Chan Zuckerberg at Stanford. The task given to them was to create a brand new novel nanobody to new variants of SARS-CoV-2. What they basically did is a prompt engineered API versions using OpenAI, AI principal investigator, AI structural biologist, AI immunologist, and the innovation was an AI critic. Basically, all that was given to the AI PI was the task. PI knew how to distribute the task, critic knew how to criticize everyone. At the end, when it went round and round, 5 mutations, all novel, were proposed. They were then humanly synthesized and tested. 2 of the 5 worked in utilizing JN.1. So this disruption is coming.
It's coming.
If any of your work can be completely standardized, AI can in theory replace you. There is a new company, I believe, Leela AI by George Church, raised $300 million in March. Everything, including the last part that in my previous example was done by humans. The synthesis is robotic, and the testing of the compounds is also robotic. So it's a complete loop with data production also being non-human and the hypothesis generation also being non-human. So this is coming. So we should be able to leverage it. I just thought I'd
add this to Anurag's, what Anurag said, you know, if we can't do it fast, we don't need to do it. Yes. Because the amount of money in 1 week an AI company is raising is amazing. You have to look at the data and see we can't look at grant giving in 6 months. If we can't do it, like what BFI said, in 2 weeks, I think we have to look at a different way of doing things.
Yeah, I have a slightly different, with what that, it's not that if we don't do it now, we will not be able to do it tomorrow because of what others would have. Because solutions had to come very diverse. Very customized solutions is what we are looking for. 1.5 billion people, such genetic diversity and geoclimatic diversity and nutrition diversity, is very likely that any of the solutions that people are thinking in the West will not be useful. We have to think for ourselves. Our own public health data need to be used to design some of these solutions. Anyway, taking from what you mentioned, the incubator 2.0, how it will be done, hub and spoke model, whatever. Souvik, the question here is, like elsewhere in the world, India too, most of the first part of the research in biomedical is done in government institutions. It's public funded research. Not necessarily government research, public funded research. And thankfully now, even with the TRL 0 level also is being funded by philanthropy. But in Indian context is largely government institutions, unlike in other countries, right? But it's not only public funded, it's also in government institutions. And if you want to expand our innovation landscape, have hundreds of more incubators, we need to ensure that the existing resources to be better utilized, which is all in the government institution. So what do you think a government policy will change this? Rather than setting up a standalone incubators, whether 100 or 200, 1,000, I don't know whether it's really there. Let's say 100, but I can only say 5, I can only remember 5 names at any given time of the day. So in that context, what is that we need to do to that every lab, 50% of the resources can be used by incubators or industry relationship or some industry-oriented research or sponsored research?
Thanks. Yeah. So you are basically looking forward, something, kind of policy by the government. So to my, understanding or my opinion is that policy is there. Okay, policy in the sense of how to work with incubators or how to work with industry from a government institute. Everything is there. Okay, what is lacking is the first, what Deepanwita was talking about, how fast we can take a decision. Okay, that is absolutely absent in government sector. Okay, and if we make this kind of decision much faster, the way it has to be, then I don't think there is a lack of any policies, because there is a policy how to set up or tie up with industry by all government institute, being CSR one of the earliest say, a kind of organization who used to work with industry. There are a lot of CSR institute, they have started incubator center. The second problem which I see is that again these are fragmented. Can I connect them? In a very, very layman terms, if I can give you kind of understanding, is that everybody we used to burn up paper using lens, and we used to use the convex lens, concave lens, not the convex lens. So people like organization like BFI can serve like a convex lens, collecting resources and concentrate to a particular areas or problem which we can solve it. This connection or connecting these dots are missing. So first, how we can work and how we can connect dots, and how we can concentrate the resources for a particular areas or particular problem. If we can solve these 3 problems, I think we will deliver much better way. I think so.
Great, thanks.
Thank you. Coming to you, Malathi, there's so much stuff happening now, right? We hear about CRISPR, Cas9, Cas12, mRNA technologies, AI-based innovation. This has never happened before, at least not in my 30 plus years of working, right? So many changes, so many new technologies. I may be stepping on somebody's IP, etc. In your opinion, how do you think India is viewing the IP frameworks around this rapidly changing tech bio environment? Not biotech, but tech bio environment. And that's part A. Part B is, how do we gear up for it even? It'll be a great education for us if you can give a synopsis. How do we gear up for this? Because we hear our fellow panelists talking about how AI is starting from everything from target identification to synthesizing compounds. So I think it's going to be a very, very complex area to work in. So would love to hear your thoughts.
I think, we all can say, we can't move that fast, so let's give up. I agree with what Professor Shashidhara is saying, is that I think we should use this as an opportunity to use AI to come up with these things, because now it's open to everybody. What an American or a Chinese can do, we can also do. Why are we not doing? So let me give you said about molecule, correct? I now know receptors, let's say, CD20 receptor or PCSK9 for cholesterol. Why are we still dependent on innovator antibodies? It's a little more complex issue, but now when I know that this is the target, PCSK9 for cholesterol or CD20, I will use AI to come up and create an antibody on my lab system. And then, like he said, it is happening. It is happening. So what did China do? Okay, Keytruda, you have, I will make a better product than Keytruda. I think today is, we need to just jump now, leapfrog, jump, whatever it is, and use the AI, internet, and start working to now create those new molecules in the lab, which can be done. It can be done for small molecules much faster than for antibodies. But I think for antibodies also we have, I've just written a paper some time back that how I can create antibody. If I now want to go to lab, I will use only AI. And I will be able to create antibodies which are the fastest selling drugs today. Anti-cancer drug, any of those immunotherapy drugs, and so on. I think it is possible. I think this is how, but this is my policy change. Because what happens in China, they decide, oh, Keytruda is a very important drug. Can we imitate it? Can we make newer molecules, not copycat, newer molecules and take on the world? If it is semaglutide, can I have drugs for GLP? If it is any other CAR-T technology, can we do it? So I'm thinking that this is the best time for all those incubators, startups, to now use AI to design. So we need good AI agents. You need to think and give the right prompt to give the right answer, to get the right answer. And so I think in diagnostics, in all healthcare, and not only that, in IP, even our patent offices have to change, take on AI. Just like she said, 12,000, many of the IPs which were doing search have all closed down. Go to Perplexity, go to ChatGPT. I don't need anything more. So I think we all have to do, because now I think we're on a level playing field. We cannot be crying, oh, I don't have. You have it there. Use DeepSeek, use ChatGPT, and try to, just go to the next level. If we don't do it, I think we'll be left out.
Thank you, thank you. So we have most discussed so many aspects of this whole pipeline. We started with how to scale up our community size, more innovators, how to incubate those innovations, and then how to facilitate use of the existing resources so that we can do more from less, and also IP protection and everything. The last mile connection is another big mystery in Indian context and a big gap. So I want to sort of throw this question to Ashish. You also work with big industries, Reliance, and also extensively at CSR Labs. So how to take it to whatever the proof of concept, prototype, the product to the next level where it goes to larger industry and standardize the whole process of manufacturing and take it to the large scale and at low cost so that it will reach the end beneficiaries with affordability and accessibility so that there is equity in the society for this. In Indian context, that's very important. So we still have not reached that seamlessly that any product will, go this pipeline and will reach the larger industry. That lack of confidence in that one also sort of suppresses innovation very often because no one wants to get into this. So what I will do for 3 years, my startup will end up continuously being a startup. Then how to go to the next level?
Yeah, thank you, Shashi. Very important question. And as a process engineer, chemical engineer, process engineer, and having worked with a large number of pharma companies, for instance, at NCL, this is what we call the valley of death. We may use the best of AI tools available to, innovate a molecule, or we may want to use an innovator molecule. Ultimately, we want to take it to the masses, and that needs manufacturing. So, if you have the innovation done in academia or in a research lab such as ours, To translate that into large-scale manufacturing is a jump in TRL levels. At labs like ours, or perhaps now universities, you are spanning TRL levels of 2 to 4. What the industry wants more often is TRL 8, 9 technologies. And this is precisely the valley of death that today we do not have very good answers to in India. There is a huge jump in terms of financial risks, market risks, technology risks that need to be taken when you take a process for making any of these molecules from lab scale to an industrially manufacturable scale. There are all of these risks involved. The industry today in India doesn't want to take those risks. The pharma is a little bit of an exception, but still most of the pharma industries, and especially the big, not the big ones, but there are a large number of companies that do intermediates. They are smaller companies, anywhere from 100 crore to 7,000, 8,000 crore companies. They do not have the financial wherewithal to take that risk. The financial risk, the technology risks. The academics are unable to cross that barrier, okay, for various reasons, right? And therefore, how do we bridge this valley of death, to me, is a question that needs to be answered immediately now. Okay? I believe we need new set of institutions who can bridge this gap. And there are great models that are available outside India. Fraunhofer is a great example. The catapult system in the UK is a great example. And these institutes are created with the sole purpose of bridging the valley of death. They are not innovators. They are not manufacturers. They are there to bridge this valley of death. So very sharp focus, extremely well-defined IP laws, IP rules that they follow, very transparent rules for transfers of technology. That gives huge confidence to manufacturers and to academics that no IP laws will be, nobody will steal your IP, and those sort of doubts that people have. So I believe in India we need to look at these models and think of creating new systems, new entities, which will do this very, very important task of taking innovations from academia, taking them to a scale where industry will say, now I have great confidence in this technology and I will take it from here on. I think that, to me, is a very, very important question that needs to be answered.
Thanks. I think it's a very important point that it has to be done today, because all the discussion in the last couple of years, globally and particularly in the context, everything has to be accelerated. If we are accelerating the whole innovation, we're accelerating the product development, design and development, then how will it reach the people? That's where this has to happen. If we are let's say in a couple of years, 100 products are ready to be going to the market, then where are we? That's a very important point. You want to add something, Anurag?
Satya, do we have time for audience for a question? Because I know I was asked to. 2 minutes, 2 questions. Before we go to 2 questions, maximum 5 minutes. Right. So before we open it up to you guys, I just want to have our fellow panelists maybe make one quick last statement, put them on a hot seat to say if you have one thing to say, suggest to some ministry or minister or department, what would that be? Because Satya and their team are making notes. Right, Satya? We're going to make this into an app note and give it to the government so we don't lose this opportunity of this great brain power. So we're just going to go through quickly to hear from them one last comment, suggestion, and then open it up for question. Over to you, Anurag.
I think ease of doing research already recognized as a problem, and I think we're all looking for solutions.
Ease of doing research. Thank you.
Yeah,
Malathi.
I think we need reform in the IP policy and IP sector, but one of the biggest deterrent is the Biodiversity Act. And if the biotech has to go and do ease of doing business, the Biological Diversity Act has to be amended.
National Biodiversity Act is dinosaurial, absolutely needs amendment. Thank you. Deepanvita.
I think it's time what Professor Ashish Lele said. I think we need institutions that understand scale and can build scale. So actually we are, as IKP, our 2.0 is actually to morph into an ecosystem player that scales. And I think whoever can do it will survive and will do well. I think
and
scale
that,
is the idea.
Scale is the idea, and that echoes what Professor Sasidhara said, right? If you're talking about accelerating innovation, we need to also accelerate how institutions are behaving and are moving. Thank you very much. Souvik.
Yeah, with few words, I will, suggest that keeping science and scientists outside of bureaucracy.
Wow. Interesting. Keep science and scientists out of? I think that we...
So it's called ease of doing science.
Oh, ease of doing science. Thank you. Ashish, last word, my friend.
An explanatory.
Bridge the valley of death, create new institutes, new entities with very, very sharp focus to bridge that valley of death. Otherwise, innovations will stay in the labs and they will, the industry will keep licensing from outside.
One
I
very
also
quick one. Every time I hear the Valley of Death, I think of the charge of the Light Brigade. So create the Light Brigade.
Anand, I also want to add my point here. So in the news, everybody talking about SIR these days. Don't worry about what is SIR in the news. But, in CSR or DST has what's called SSR, Scientist Social Responsibility, right? So I think we should introduce what's called SIR, that directly or indirectly, each scientist in the country, publicly funded particular ones, should have at least some work towards helping one innovator, right? Directly or indirectly. I think SIR is what we should introduce.
Love it. Guys, we have time for one or two quick questions. Please be very specific about the question. No opinions, please. Question, and if you have any one particular person you want to. Can someone help us with the floor mics, please? Yeah, there is a mic there. Oh, there is? Okay.
My name is Pavandar. This is for Malathi ma'am. So given that AI can predict novelty, non-obviousness, and application, is there a room for human-centric patent filing in future?
Wow. Tough question.
Very difficult to answer because it will be, it will change the whole scenario, I think, of, obviousness, novelty, and how we go about the IP scenario.
Anyone can join in. That's a great question. No easy answers, as Malathi said.
I'll give you one very quick example using Keytruda as the base. So Keytruda is an antibody to PD-1, PD-L1. Recently, Q Biopharma got the bright idea, what if you tag interleukin-2, which stimulates cells along with Keytruda, identifying the cells. That particular combination with that particular spacing, I would still call it human-centric, because it wasn't about antibody design. It was just rethinking the problem that Keytruda was causing. So that's the way I would say it.
I think we have time for, I've been told we have time for one more. Please be specific.
Yeah.
Thank you. Yeah. Gentlemen.
Hello.
Yes, we can hear you.
Yeah, I'm Madhu Masudara from Hyderabad. The question is on, there is a big elephant in the room. There are many actually. There is one I'm talking about is, most of the money government spends on the institutes, and the institutes they don't have liberty to do what they want to do. Like all of us appreciate what happened in 91, the lack of control, less control by the government actually helped so many things to happen. I do not know why ICMR or CSR or DST or DBT cannot liberate their scientists to do what they want to do. And we know great examples in the West where Bayh-Dole Act has actually liberated universities to do many things. I know why that's a straightforward example we don't follow. I thought...
Professor? Good point. I think we should take the freedom ourselves.
Okay, guys, listen, I'm really out of time. Please give it up to this amazing group of panelists. And it's my honor to be with them. Thank you so much. Thank you.